Welcome back to Sarnia Lambton Daily. Information, communication, certainly a big key right now as we all deal with the pandemic. But where do you get this information? We've seen various forms of it, but certainly getting accurate information is very important. That's where 211 Ontario comes in, and we're joined now by Executive Director of 211 Ontario, Karen Milligan. And first of all, right off the bat, Karen, what is 211 Ontario?
Oh, thanks. Well, I mean, 211, for those who aren't aware of it already, is an information and referral service that essentially helps people navigate all of the services that exist in communities. So, from the social services, the community-based supports, health services, and government services.
How long has 211 Ontario been around?
We've been in operation starting in Toronto since 2002, and in most areas across the province joined a little later, but we've had full Ontario coverage since late 2011.
Certainly been in Sarnia Lambton for a while now. So during a pandemic like this, when would someone potentially reach out to 211?
Great question, and I think every emergency that 211 plays a part in is a little bit different, and this one is unlike any other. So what we're hearing and what we're seeing right now is that majority of the needs are around basic things like how to get food, some looking for shelter, as well as things like mental health support. There's a lot of very anxious people out there right now, so pointing people in the direction of helplines that are already operating in a virtual kind of way. And certainly things such as people that need support in their home and trying to direct them properly.
And are you finding that people, when they reach out and find out about those services, especially referred to services in their region, it's a little bit of a a glimmer of hope, maybe knowing, okay, those services are there, and at least knowing, this is where 211 is the bridge to point them in that direction?
Absolutely. And because 211 is here 24/7, I think many of our public health lines, et cetera, and even municipal services are quite strained at the moment. So having the ability to even just reach out in the middle of the night, identify what the issue is, and have a plan in place for the next day is often all that's needed to really calm anxieties.
As we're into this pandemic, everything's in flux right now. A lot of businesses shut down. Are you finding too that's where everyone sort of has to adjust on the fly a little bit, where maybe a service that wasn't or was previously available maybe isn't right now, and when people are calling, obviously, and your support staff, trying to point them in the right direction, but everyone kind of working together because everything is sort of in flux right now.
It absolutely is. And yeah, we have to work very closely with all of our agency partners who are delivering services. We rely on them to let us know how those services are changing so that the navigators on the phone will know exactly where to point people. And it is, as you say, very much in flux at the moment. So what we're working on is creating a bit of a follow-up team so that as new services emerge or change, that we're able to push out information to people even in a couple of weeks' time if they've identified a need that we can't yet meet.
I know over the years it's certainly been various local partners have assisted in gathering that information. Previously, Information Sarnia Lambton was, of course, a group that's been had, of course, the resources, and I'm sure how important is it where those records. I think every year, I know in our office, we've received a request to say, please, have your information up to date. Is this information up to date? I'm sure, and sometimes it's like, oh yeah, here's another one of those update requests. Exactly. Now, this is so important that all those records have been kept up to date over the years.
It truly is, and in many cases right now, we're pointing back to local communities as the source of the most up-to-date information, especially as it relates to public health units and things of that nature. But as far as the social services that are emerging, many of those are being delivered by very grassroots organizations, in some cases, community groups that are gathering. So trying to keep a handle on all of that is challenging, and our staff are doing an amazing job, but anything that agencies can do to proactively let us know is really appreciated.
When shouldn't someone call 211?
Another great question. So we are definitely not medical professionals, and we can't give any advice as to when somebody should go to the ER. I mean, there's been some great tools developed by public health as well as by the province, self-assessment tools. There's also Telehealth Ontario. Their lines are clearly a little bit overwhelmed at the moment, but there's tools in place to deal with those medical issues. And so those are not things that we are trying to answer. It's really those social supports that not only are needed right now, but as more and more people are laid off and trying to figure out unemployment, perhaps for the first time, those critical supports that we're able to point them to are going to become even more necessary.
Karen, are you finding in some cases maybe people, they've tried one avenue, such as you said, the people maybe, don't call 211 for, of course, medical related anything like that, but now people maybe because of telehealth being bogged down, and obviously we're not speaking on their side, but still people are reaching out to 211 for things that maybe you can't help with. We're maybe just asking people, just be a little more patient. Those organizations will get to you, and of course we're here to help when we're through the information side if we can.
Absolutely. For some of those folks in the meantime, maybe pointing them to a mental health crisis line would, in the interim, if they're, depending on their level of anxiety, I think there's ways that we can calm those anxieties and also just give people the information they need for follow-up.
So if someone watching us right now and is maybe over the weekend, for example, and trying to find access to some information, when can they call for help?
24/7. So our phone lines are 24/7. We do also offer chat service Monday to Friday, 7 a.m. to 9 p.m. And people can also email us, which again, as our phone lines become busier, will become an important channel, but you can email gethelp@211ontario.ca.
And of course, 211ontario.ca is the website as we flash it up on screen. As you were talking there, Karen, I'm sure your staff has certainly been very busy, but full credit to them. I've got to think that dealing with a whole new situation, they get calls on a regular basis, but I've got to think during a pandemic, things get ratcheted up even more.
Absolutely. So yeah, we're looking at any and all ways to increase our capacity and also look after our staff. I mean, many of them are struggling with the same issues we all are, trying to work from home with young kids or arrange childcare if they do have to go into the office. But those challenges are the same for our front lines. Plus, they're dealing with the anxiety levels and really in some cases, a desperate need for very basic services.
Well, Karen Milligan, Executive Director of 211 Ontario, we appreciate you joining us here today.
Thank you very much for having us on and for helping share the word about 211.
Once again, looking for information about services or things in the area, you can dial 211 or go to their website, 211ontario.ca. More to come. You're watching Sarnia Lambton Daily on YourTV.